Folks, thanks for joining us today. My name's John Dubas with Premier Marketing, and we'll be spending the next 45 minutes to an hour or so discussing ways to make the investment that you're putting into one of your marketing initiatives, the retail marketing venue, and the use of retail pharmacy in your AEP marketing program, how to maximize the value that you're getting out of that, not just talking about the dollars that are spent for the cost of the program, but also the value that it brings you not only during AEP, but in the near immediate future and for years beyond it if we do it correctly. Today's presentation is being recorded, and it, along with the slide deck and pieces that we'll reference through the course of the presentation, will be sent to everyone who has RSVP'd for today's presentation. It is a crucial part of our planning process right now, considering we're within 2 weeks of the marketing period for AEP already, and some of this information can be implemented very quickly, and I think can make a big difference as to the amount of success that you see in your marketing programs for AEP and moving forward. A bit of housekeeping: you'll notice in the software for this presentation that there's a section for questions. If you would, please put your questions in there as they arise. We find we handle many of the questions through the course of the presentation, but we want to make certain that we answer all your inquiries as quickly and as efficiently as possible. Another piece of information, we're going to put ourselves on kind of a baseline as to who Premier Marketing is. For those of you who aren't as familiar with our organization, we are a national marketing organization founded in 1968 that's part of the Integrity Marketing Platform with offices across the country. We act as an insurance wholesaler, providing insurance services to the public through independent insurance agents such as yourself, and that relationship is facilitated by contracts that are offered at the highest possible commission levels, with recruiting contracts available to those who qualify. As I mentioned, we were founded in 1968, so that means recently we celebrated a milestone in our history, our 50th anniversary, and we feel that's quite an accomplishment for what began as a small family agency in rural Nebraska that's become one of the largest marketing organizations of its type in the country. And we do so through a full portfolio of products that makes retail and other marketing initiatives a success. In the Medicare arena, we offer the Medicare Advantage and Medicare Supplement programs in addition to the standalone Part B plans, but we also offer a full portfolio of life insurance and annuity products, including final expense life insurance, pre-need plans, long and short-term care programs, disability income plans, and ancillary benefits such as dental, vision, and hearing programs, critical illness cancer plans, and hospital indemnity programs. When we look at the retail programs that are out there, many of them are specific to one carrier. One major exception to that asks that you have multiple contracts based on the plans in your particular area. And so we accommodate that through the different Medicare Advantage programs, the national carriers that we contract with, and many of the strong regional carriers that can make a difference for you in your target market. That same philosophy carries over into the standalone prescription drug plans, where that PDP portfolio has the national carriers on play there for you and are all available through our organization. You'll note that we still have Envision RX on this program, even though they have pulled distribution from the broker channels across the country, all broker channels. We do that to remind you to watch for your prospects and clients who had been interested or enrolled in that program in the past, so you can take care of them appropriately. When you look at the Medicare Supplement portfolio, it's very large and robust, some really big hitters in this lineup, and we have different tools in play that can help you be successful in this space as well. While many of the retail programs concentrate on MA and PDP programs, there is a need for a portfolio of Medicare supplements to have in your offerings, and we want to make certain that we can accommodate not only you, but the needs of our prospects and clients through this selection of carriers. When you look at the ancillary products in each of those categories, you got the national leaders. And these not only give us an opportunity to create another revenue stream for our agencies, but also accommodate the needs that aren't covered fully or to any degree at all in the base medical programs, be they Medicare Advantage or Medicare Supplement plans. It's also a great way to market and to open doors for additional people to bring into your book of business. When we look at the Medicare market overall, you're not on a call like this without knowing some of these numbers, but we'll review them very briefly. Everyone speaks of the silver tsunami, the aging of the baby boomers, 10,000 people a day, 1 every 10 seconds. And if you look at Medicare based just on age, however, you're missing a good portion of the picture. Even though there's approximately, I see estimates anywhere from 59 to 62 million people on Medicare, it's not just because they're over the age of 65. Because some of those folks, once they hit 65, don't necessarily access their Medicare benefits. They continue to work or pull benefits from another source. So there's a portion of those folks that have turned 65 that aren't accessing Medicare, but about a sixth of the Medicare population is under the age of 65 and accessing it because of a medical disability. And so it's a very large market, as I'm sure you're all aware, and it's a very diverse market that has some different challenges. 2/3 of the population has 3+ chronic illnesses, and the income and savings for these individuals handicap them to a degree as well. So having a portfolio of products that we can offer to address their needs across the board, and particularly in venues that ask for selection, it's important for us to look not only at the carriers and the commission and everything else that goes into offering an insurance product, but what do we need to accommodate the needs of our prospects and clients? Because they have choices. An old sales manager of mine used to say, a decision to make a decision is a decision. And to be honest, when someone ages into Medicare, they don't have to do anything else. They don't have to pick up the optional B coverage if they don't want to. Most do, thankfully. Some of them then may decide that that's enough and they'll self-insure for the rest. Others will pick up a standalone Part D program to help with those medications. And that's what gives us a great advantage in the retail settings because we can do those analyses for them. And some others will pick up a standardized, modernized Medicare supplement to take care of the shortfall in the medical portion of coverage through Medicare. Or others will look to the Medicare Part C plans, the Medicare Advantage plans, that in most cases integrate in all types of coverage into a singular program offered by a private insurance company. Whatever choice they make, as we encounter them in whatever situation there is, retail particularly, we have the options to accommodate the needs that they have now and moving forward. When you look at some of the things that the choices that people make when they first come into Medicare, it's a near even split as to whether or not they're going to take an MA or a PDP or a PDP and a Med Sup program. So we have to be open to not only our own preconceptions as to what might be best for an individual, but evaluate their circumstances and see what route would be best for them. Sometimes that need brings in a need for additional help, and that might be as simple as a translator on some of the acronyms. So some of the follow-up that you'll see to today's presentation will have a link to an acronym guide that helps you determine what an ANOC is, or whatever those series of letters are. You have a translator for you. So when we look at today's topic and take into account the Medicare market overall, the size of it, the diverse needs that are part of the program, it's also important for us to look at and decide how we can best make use of our most valuable resource, and that's our time. And many agents have found that working retail establishments, a pharmacy in the community, be it with a singular chain, through a singular carrier, or part of the Walmart program, whatever, it can act as a real linchpin in our contact with the public and finding those folks that need us and the services that we offer. So as we go into this particular topic, it's a question of not just what have we spent or what will we budget for promoting our efforts in this area, but also what are the return on investment going to come to us? How is it going to come to us? Are we going to look at it as just production through AEP or through the contacts and the networking that we can set up that will last us throughout the year and for years to come? Because it's important not to take anything at just a singular purpose. It's not just a program that will make or break our programs moving into AEP, but integrating in a total program, a plan that includes retail, can make all the difference in the world as to whether or not that's a good experience for you. There are agents that will swear by retail marketing and how they've established a reputation in the community and also with the personnel in the different locations that they work at, that they are a subject matter expert for the public in this area. Some folks will go into a location and wonder, why am I doing this? I'm wasting my time. No one's coming to see me, all the time while reading a paper or perhaps looking at their phone. So some of the things we have to take into account are not just the old real estate tried adage of location, location, location. It's also how are we tying in all the efforts to make this profitable for us? Because when you work retail, you've got different options. There are probably a number of you that are working with a specific carrier. There are a number of the big boys that put out their own programs when it comes to retail, and they have different support programs that come into play that can be helpful for us. And we'll touch on those today as well. There is, of course, the grand master of these programs from the past, and that is the program that has been hosted by, in one incarnation or another, by Walmart. With the great footprint of stores that they have across the country, it acts as a great indicator of places that we can go and work efficiently. But it's also important to note that we can maximize the value not only of the support that Walmart gives to the program, and there's a ton of it, but also some of the things we can do to augment those efforts that will ingratiate ourselves with the management of the store and the department we're working with, but also in that area that we have chosen to target market. And then, of course, there's always the do-it-yourself, the DIY program, the Grassroots program, where you set up a retail opportunity no matter what time of the year it is, or in certain circumstances as we roll into AEP, how we can partner with other centers of influence in the community that may not be just pharmacy-based. When you look at the carrier help, I've got some examples here of what United Healthcare does for folks that are part of that program, where they lay out pre-approved programs or different marketing pieces where you can go in and personalize that material and, in many cases, with help of local market management, publicize your activity in that location to the general public and to centers of influence in the community. They have different pieces that will allow you to state your time and date as to when you're available at that location, much as what's required in the Walmart program where you have to post your schedule. These pieces can be very helpful, and they're all available on United Healthcare's toolkit. They also make available other marketing tools that can be helpful for you, and many of these may be supplied to you by local area marketing management with United Healthcare to help you increase the odds of your success in that retail location. Some very nice pieces that will draw attention to your location and, importantly, to you and the product that you're offering. However, a lot of people spend a lot of time in Walmart, and sometimes, depending upon the time you go in there, you have different traffic flow based on some of the community resources that are available there, different living facilities that may bus people to locations, things of that nature. But Walmart has a complete program where they support the agent through the entire process. And it is the program that requires you to work on a marketing point of a choice model. Those of you that are involved in the program go, John, why are you saying this? We all know this. However, when you look at this, you can look at some of the different pieces that come into play, the different carriers that are important to you in your chosen location, and realize that not only working the Walmart system and the different pieces of support that they have available to you, but hand in hand with some of the carriers that are preeminent in that target market can make a big difference for you, because you can leverage some of the support from the carriers and from the folks with whom you contract. So that's an important point to keep in mind when you look at Walmart and the multitude of programs that they have available as part of their campaign. Certification for the Walmart locations? Well, this last week, a week ago today actually, is the time where you needed a bunch of certifications to be completed, not only with the carriers, but in a timetable that they would show up in Walmart's systems. So it's important for us to make certain that we have handled our base requirements and are able to move forward. And that includes doing the trainings for the Walmart program specifically, the certifications for the carriers that they're asking for in your particular market, and any other training that they ask for us to complete. Because it's important for us to do a thorough pre-planning when it comes to the success of the program. And that includes making certain that the folks that are in the location that you are utilizing know who you are. And that is a relationship building situation where you've talked to the manager of the pharmacy department, some of the farm techs, the store manager possibly, the people who schedule the folks up front at the cashiers, the different people that are there for you to help announce your presence in the store. Walmart does a number of different things with the inter-store TV system they have, announcements over the phone, but having people speak for you can make a huge difference. And so that's one of the things that when we look at the requirements that Walmart puts into play for participation, how we can take and change our perspective as to what's a requirement by a program versus what is needed to be a success in that area. So going in and talking to the folks before your shift to make certain that they know that you're there, reporting in. And then as your shift ends, letting them know that you're gone for the day, but here's my contact information so folks can reach out to me even if I'm not here. Both active and passive marketing at that location is crucial for your success. And in many stores, they leave your kiosk out and enable you to do marketing when you're not there. So that's very important. But part of that is because of the image and the reputation that you've garnered because you're persistent but professional. You're adding value to that particular location by asking questions, bringing up the pharmacy staff to do what they do best, and that's accommodate requests for medications and doing the reviews of those drugs. So you have different pieces that can really make a difference as to how you're perceived in that location. Are you just there as a bit of a parasite in a manner of speaking, or is it a symbiotic relationship where you're helping that department through your knowledge of low-income subsidy, extra help programs, and Medicare savings programs, not to mention the differences between the plans themselves and how they work with that particular location. So doing your homework in both creating the relationship with the location's personnel and doing your back training can make a huge difference. They ask that you become very aware of your surroundings when you are on the clock, so to speak. And that's really difficult to do sometimes when we have such an electronic world. Our phone's always beeping or buzzing, or we can do this so simply. Tablets make it easy for us to do things outside of work as well. But when we're on staff at a location, it's important that we realize our purpose is to generate prospects, to generate discussions. And that then, well, some of the success of that is predicated by how we present ourselves, how we're dressed, how we are comporting ourselves during our stay in that store, and the fact that we are looking to help individuals, looking for people to talk to, and we're attired appropriately for it. Some of the things that they have come up with here recently, that if you've been in their systems and are looking for some of the marketing support, they have some very nice posters and mailers and social media posts that can really help you in your publicizing your participation in this effort. The social media posts are one of the things that we've talked about for years that some people have been very creative with, but some folks, because it hadn't had a bit of a template, were a little worried about how they could comply compliantly to this type of publication. Well, they've taken the worry out of that in this campaign by utilizing a storehouse of information with social media posts as part of it. It can make a big difference as to the success for your particular location, and it's a nice piece to share with the management of the store and the department so they realize that you are marketing for them as well, and it enhances that relationship you have then for that time period and into the future. There's also some different things that you can use as long as we stay compliant with different pieces of carrier sales material. It's important that we have the material for the featured products in our store, the contracts that come with that, of course. And so we need a bit of prep time before our shift starts to make certain that material is there. And as we close down, that we do things appropriately to distribute material, but do so we can still garner the names and contact information of the folks that need that information. So some different things we can do in that regard through the support programs with Walmart itself. In the do-it-yourself category, well, obviously, there are centers of influence in the community that aren't part of a national chain. And in many times, your presence in a quasi-retail environment helps their foot traffic as well. We're obviously in a very unique situation with the pandemic, and whatever we do in retail can not only be translated from the face-to-face, but also influenced by the virtual tools that we have available for us. And that includes identifying not just our center of influence, but also then the locations in the community that we can use to help drive activity to our base of operations. That includes a CVS or a Walgreens or whatever store it happens to be, a Walmart, or it could be a Park and Recs location that we've chosen for our hub in the community, or whatever other center of influence that we're using to create an extra office in our community with our staffing that location. So going through some of the different centers of influence and a DIY situation, it not only gives us an idea of who can be a hub for our marketing activity, but also highlight the other organizations in the area that can make our chosen location in whatever program it happens to be more successful. And you have an opportunity to do so, to publicize that based on some different generic material that's available to you as well. Keep in mind, when you work at Walmart, they want you to use their materials. If you're working with a carrier, obviously, as we illustrated earlier with the toolkit information from United Healthcare, you're going to want to work with your carrier to publicize that location. And that's the same if it's Aetna, if it's Humana, if it's United, if it's Anthem, if it's whomever you're working that retail piece with. They'll have supplies to help make you successful. If they don't, then we become creative and we look for other help in order to publicize that location. And particularly if we're doing it on a quasi-generic basis, where we're doing it with a center of influence in the community that's not branded by a carrier or an initiative, we can do some things like this to help publicize that location. So we've done a bit of location identification. You guys, if you're in Walmart or on the other campaigns, you've done that a long time ago. Now it's then a question of making certain, is all the contracting and certification complete? In some of the programs, it better be by this point in time or you're behind it. Then, are we comfortable with not only the concepts that we're talking about in a retail location, the extra help for medication costs, the LIS program, the Medicare savings programs, but also, do we know the product and the comparison of other programs in the area And have we learned that through our training that we've invested already? And also, have we mapped out a strategy for success? What else are we doing to support that initiative other than showing up early, leaving late, and sitting there very attentively? There are other things we need to do to make a success. So some of the other things that we'll recommend for you to make certain that you have under your belt is the different trainings, not only the certifications from the different carriers, but the rollouts that they offer in the different markets that tell you the ins and outs of the programs that are offered for you, for your prospects and clients. But also, if you're working a particular carrier-specific initiative, are you comfortable with their e-app? You can save a lot of time, a lot of effort, a lot of hassle on the back end, but it also gives you the indication that you have an opportunity to spend less time on that process than you would if you're going through and doing some things on a manual paper basis. It speeds up the process, not only in the application, but also the processing and delivery of those programs to the people that you're enrolling. Most of the carriers, if they got a retail program, they're asking you to do additional training too. Don't look at that as an onus, as a burden you have to satisfy, because there are helpful hints and tips in those trainings that can help you make that program a success for you. And it's not only carrier specific. Walmart has a number of programs that are out there that can help you. We have different programs also that can help you, hopefully, as well, through different trainings such as today. And that includes having information on how to make the community work for you. And that's what we're going to dive into in greater detail here in just a second. But this is using those centers of influence in the community, the different provider sites, the different social service areas that can be of helpful for you, the senior living facilities, the faith-based organizations in your community, how you can leverage relationships with them now and in the future to make this more successful. And then, of course, as I've mentioned a couple of times, it's so important to be aware of how low-income subsidy and Medicare savings plans will affect the programs, because if you don't and someone else knows that, they can bump you out pretty easily. But it's also a way to maximize the benefits for your prospects and clients, and it's a great way to generate additional marketing boost through the referral process by these people that you've helped. It's also important that if you're working, particularly like in a Walmart or a situation where you're dealing with more than one carrier, do you have the electronic means, the electronic support to help speed that process of comparison, compliantly, of course, and how you can enroll if it is, oh boy, it's going to take more than one close, or I've talked to the individual here, we've got another appointment set, do they have all the information that's necessary to make a decision and maximize the efficiency of your time. Having information on these programs, like our Medicare Center program, which, by the way, there is another training on that next week on how to work that system, is very important for us. It's also crucial that we know how to leverage the third-party influencers that are a big part of Medicare's decision process. And that includes the Medicare Plan Finder on the Medicare.gov website, and how you can integrate that into part of the other systems that you use. Because let's face it, that program's not meant as a sales tool. It's meant to deliver information to an individual so they can make a decision on their own for a good portion of it. We can use some of that same material to make certain that the folks we deal with realize that we're crucial in helping them determine what may be the best plan for them in the area. Because we don't go off of just a monthly premium. We look at the entirety of the plan, how it's going to affect cost, not just with their medications, but their Medicare medical costs throughout the year, and knowing how that works is crucial for us. It's also then very important for us to have our duckies in a row when it comes to our basic understanding of Medicare 101, because a lot of the folks that we visit with realize they have Medicare, but they don't realize just how it works or how they can get answers. A recent publication I read mentioned that less than 40% of the Medicare population know exactly even what questions to ask. So our being fluent in Medicareese is very important for us to be successful, because once again, we're not putting all our eggs in one basket, but we are looking to make our target market ours. We are going to be the subject matter expert in that area. So as we've planted our flag with the location that we selected, be it with whatever program is out there and how we're moving forward in this initiative, we're looking for centers of influence around that location. So we're looking for churches, we're looking for senior centers, we're looking for nutrition sites, we're looking for where people live, worship, or access care. So, the senior living facilities, provider sites, all these locations can be very crucial for us, not only in making our retail initiative more successful, but also add to additional marketing efforts. Because we'll note in each of these areas, it gives us then an opportunity to spread our gospel through other fingers into the community. And there are people in different areas of influence by these centers of influence that may not respond to any other type of marketing. So going in depth in Grassroots can make a big difference. When you have your location for your retail hub, go into churchangel.com and find some of the faith-based organizations that surround that location. And with the use of those marketing tools provided to you either by your own initiative or by the programs themselves, the carrier or Walmart, having that information and visiting these locations can make a crucial difference to you. And when I say visiting these locations, that may not be just knocking on the door of this physical location and saying, here's some of my flyers, I'm selling, you buying? Not necessarily. We can do some of the same things telephonically and reach out into the community that way as well. And through our expertise that we've acquired over this social distancing situation we've been in for a number of months already, lending that expertise to these organizations can be very helpful as well, because they have to reach their community as well. And we see in many circumstances, worshiping together in an open forum like this has been curtailed as well. So being aware of how we can do things virtually in this area can be very, very helpful for us. And utilizing this website, it has contact information in it. Centering that information around our hub can make a big difference. This is how the site looks. It allows you to go in and pick out by zip code, by faith, a number of different things that you can do to make it helpful to you to identify those locations. And there are sites out there to do the same thing for faith-based non-Christian facilities, in a manner of speaking. The Jewish community, you're going into a search for mosques in a different location. They are all there for you to garner the support of the faith-based community. And it doesn't matter if it's a faith you share or not, because quite frankly, what you're looking to do is help people regardless of some of the other things that make them similar or different from you. And this information is coming to you as part of the follow-up, so you don't have to try, gee, John, don't go so fast, let me get that website. You'll have this information. And this is something I would strongly recommend that you, if you're involved in retail now or becoming involved, this is your homework for the next week or so. Finding those locations, reaching out, letting them know when you're going to be in a particular location and the services that you provide. And that carries over into some of the nutrition sites as well, because some of the folks that are accessing assistance through nutrition sites are some of the people that may well qualify for the extra assistance on the programs too. So that extra help program, the low income subsidy program, the Medicare savings plans, your knowledge and expertise in that area can help drive down their cost, and you're going to find a welcome audience for folks that have that need, that frequent nutrition sites, be it for the food itself, for the social element, for whatever it happens to be. If people are going there, you have the information that can make decision-making into the future very, very easy for them. And it's very important for us to make certain that folks that are particularly influenced by price realize that there are changes year over year in these programs we need to make them aware of. The changes in formulary, changes in the tiers in the formulary, the changes of the cost of the co-payments in the different tiers, or the medications themselves as to where they're placed. And our knowledge and expertise, not only in delivering that information, but making it available to those who are becoming aware of that need, can be very important. And this can be a very crucial partner in that regard. There are also food pantries that you can access through foodpantries.org, and look at other sites that can help you find senior centers, as this one does, or senior living facilities as well. So it not only then gives you an opportunity to publicize your participation in the retail, where they can access this information in that public third-party atmosphere, but it's also an opportunity to speak to the management of these different locations and set up meetings there as well, be it live if possible, or virtual, as we have tweaked our expertise on that over the last few months. And quite frankly, it's never going to go back to the way it was anyway, knowing that we have the tools and the opportunity and the means to deliver that information in whatever format is best served for the community. Well, we can do it quite simply through some of the tools that we picked up. You can also find different low-income housing locations where these folks have a need, not only of your help with the different plans, but the different support programs. And then, of course, delivering upon one of the strongest influencers in choices, and that is the provider partners that are delivering the care under the policies that you're selling. If you're working with a particular carrier, obviously that's easy. You can sort through their directory in a particular area and reach out to those providers in the community and make them aware that you can make their life easier through this decision process. You can also work with these programs to determine, okay, specialists or other delivery of care providers, how can I reach out to them and make them aware that I am an option for their clients as well, to deliver upon the information necessary for them to make their decision for the coming year. Knowing the provider partners can be very, very important for you. And you can pick them up quite simply off the websites of the different carriers, the different provider pieces that are out there by the insurance companies, and also making certain that you are delivering not just on doctors, but on hospitals or other providers of care, including dentists. We don't see dentists marketed quite as heavily as some of the primary care or specialists in the community, but this is a great way to reach into a segment of the population that may help you in other portions of your agency's focus. If you're doing some under 65 business, a great way to come up with people. It's also a great way to work through, once again, a network of dentists that may be carrier specific, or in general with some of the standalone dental programs that you have available to you for your prospects and clients. And then, of course, there are the other centers of influence in the community that can make a difference as well in getting the word out as to what you're doing. There are different restaurants that cater to the senior population, coffee shops, beauty parlors, bingo halls, different places of amusement, so to speak, that may be influenced by our current COVID-19 situation, but are also basically facilities that have the same challenges that you do in reaching the population. But if they have that audience, how can they deliver that information if no one's helping them do it? This can include, VFWs, other centers of influence that can make a big difference for you. When you look at restaurants in the area, you're probably aware of a location or two that seems to be a blue hair heaven in a manner of speaking. But then there are different locations that you can find that have senior discounts in the restaurant community. Because of some of the things that they're going through with the dine-in or carry-out situation, having marketing pieces that can help you identify yourself, and perhaps by working out a relationship with one of these locations, provide your information in the carry-out as well. That's an important point to look at when you deal with a pharmacy that has a very active drive-through as well. So having that material available and dispensing it through your partners in the community is all part of this great grand scheme, this comprehensive program to make that Walmart, to make that CVS, to make that whatever as successful of a marketing initiative as possible. So when you coordinate that activity, what you're doing is basically creating another office in the community that you are branding as yours. Even if you share it with other agents, you bring your own slice of life into that location and can make a big difference as to how you're perceived by not only the people that are walking through the store, but the people in the store that you're partnering with. Being a good communicator with the staff, be it management or the frontline people, can make a big difference. The government does also provide you some material that can help you in educating folks. These are available on different public websites. These are pieces off the Medicare.gov website. You have to be careful in certain initiatives as to what all you are supplying, because Walmart doesn't want any agency logoed pieces or things of that nature. So whatever you display through that location, make certain that it's approved by those folks. The carriers, generally, when you're supplying CMS location, they don't have a challenge with it at all. And if you're going into someplace generically, this can be a great help to you because people realize that you're not there with just a singular product, that you're looking to help them find resolution to their need. Some pretty cool tools that can help you with a plan finder and other pieces that come into play. A lot of the same information that you need for the government sites are also the pieces that you need for the private enrollment platforms as well. So gathering this information this way can be a very efficient way of adding to your prospect book, because you may have people in line at some of these locations and you want to do things as efficiently as possible as well. I cannot overemphasize, I should say, the support that you need from the carriers that you work with and the folks that you contract with. It's important for all of us to work together to make certain that this plan not only is coherent and makes sense to you, but also lends to the experience. Make certain that, it's not just a feel-good feeling. We're actually helping people enroll into different programs. We are productive in our space, and using all the access to all the assets that we have can be very important there. So whatever you do in the community, as you've identified the site and you've gone through and you've looked at the different partners in the community that can help you, keep a journal of what you're doing in that regard, not only for current and future reference, but also as a means to share that information with the folks that are running the location that you have selected. Make certain that they're aware that you're in the community publicizing their location and your joint effort, and you'll find that that will deepen that relationship rather quickly, and you'll find more people being referred to you from those counters, from the pharmacy counter, wherever they're sending people to you to visit about the choices that you have, and that's because they realize that you're there to help them as well. What you're doing is even supplying them with the information that you're putting out into the community. So those flyers that you've created from the Walmart resource piece, or from the carrier toolkit, or from those generic pieces that you're putting into the community, can make a huge difference as to how you're perceived, that you are actually a partner to their business model as well, and you're working to ensure your joint success. We'll do some other things also that can help you in the back end of the administration of this as well. when you look at the fact that many times you have to satisfy not only the requirements for participation with contracting and certification and the different things that go into a successful retail campaign, but you also have the last minute addition, or hey, folks are asking for this, or wow, we've got some of the base medical in play, we've got to look at some of these ancillary programs to help them with their dental or critical illness or hospital indemnity or some of the other offshoots of the conversations that you're having with your prospects and clients. This system can help you set up an agent profile and contract electronically with multiple carriers very simply and easily. A great tool for you to use, not only in preparation, but also to fill holes that you discover as you progress through the marketing season. We also help you protect your business through discounted errors and admissions coverage. This is a policy you own, and it covers you regardless of whom you're contracting through for your products. It is a great way to make certain that you are protecting yourself as opposed to being added for one product to a blanket E&O and you're uncovered for the rest. This takes care of you across the board in a very economical fashion, but also in a situation where you own your coverage. We also help you with discounted continuing education credit in order to keep your license in play. Through our association with WebCE, you can do a lot of things online very inexpensively to satisfy your continuing education credits. And you can also add to your own benefit package should you choose to do so through a modified guarantee issue non-cancelable DI policy that you share the commission and you add to your own benefit package. Much as where today's presentation is being recorded and will be available to you, will be sent to you as follow-up, but they are also, these recordings are posted on our website at premiersmi.com and on our YouTube channel. So different ways of gathering additional information about insurance concepts, insurance carriers, marketing techniques. There are different things you can go in here and do a 24/7 review of how can I work best with those providers that are so influential just a couple of miles down from my retail location. How can I thoroughly work with the faith-based community and make it another part of my overall marketing program? So different pieces like this are made available to you on a recorded basis 24/7. It's also really important to become very adept and comfortable with the introduction that we've done of our new Medicare Center program that helps you through a comprehensive electronic system to become more efficient, more effective, and stay very, very compliant. We've had a couple of different outreaches with this past week on how to work this system. It is available without cost to agents contracted with our organization. It includes multiple carriers, be they contracted with us or not, but it also gives you multiple systems to use to address the products and the need to supply that information to your prospects and clients. It also works as a simplified CRM. So it's a great way for you to track your activity, not only this year, but year over year, to do the annual reviews that are necessary to help people stay comfortable with the choices that they have made in the past with you, or to modify those choices based on the new reality that we're faced with the plans rolling out with changes in their system. This is a great way for you to stay on top of things and become more effective and efficient in what you're looking to do. 3 different platforms and one singular tool, a singular login, and then you can reference the different materials for the different programs that you're looking to offer. It's incorporating in our previous Medicare Center program powered by Connecture. It's also bringing in another program powered by Sunfire, and keeping in mind and utilizing the great tools that are available to us through our CSG actuarial piece as well. So they're all available on a singular platform, a singular login, and you can utilize them moving forward to become effective, efficient, compliant, and multiply your reach in the community. because these programs also have that microsite that they create for you, that personal URL where you can direct people to that site for them to do a little self-shopping should they choose to do so, direct them to a particular enrollment feature, whatever is necessary to make it work to deliver that information and effectively enroll and accommodate the request that you have. And you have multiple systems within a singular tool to do so now. And there are also different ways to reach out to people because, well, texting is really, really easy for most people. A lot more people have access to this tool, and it's one of the things that we insisted on the vendors powering that system to have available so we can make things as simple not only for ourselves but for our prospects and clients as well. We have an additional training next week as well on the e-scope and some of the information within the CSG piece, because that's an important component for the folks that are looking at Medicare supplements as well, because there is no one choice that's perfect for everyone. We wanted to make certain that you had the tools to be as time effective and efficient as possible in this system. It also gives you an opportunity to cross-sell and speak to other products. As long as we are using some of the tools that are required of us, such as a scope of appointment, we can open up discussions to all kinds of other products as long as they're health-based. It does also give us the opportunity to mention some of the other programs that might require a second visit, life insurance, final expense, long-term care programs, those sorts of things, annuities that require additional research, but also an additional appointment because of the MIPA regulations. All these different programs that are available to you, many times they have additional incentives for you that you can earn through the sale and accommodation of the needs of your prospects and clients with those products. So we have a specific place on our website that can help you track that information, the different trips and incentives that also help you qualify for the Premier Producers Convention as well. Some things we can do also to help drive people not only to that location, but to your phone or to your offices to increase the quantity of prospects that you visit with, include different contact lists that are available to you. Obviously, you can't cold call for MA or PDP. It's against the rules, but you can for MedSup or some of the ancillary programs like dental or final expense. We have those different programs that are in place as well for the centers of influence in the community that we mentioned before that are important for you to recognize and reach out to make them aware of what you're doing for the community through your location in that retail setting. And that includes dealing with the folks in that setting itself, the faith-based organizations in the area, the different providers too. We have recorded pieces on the website for that as well, and systems that can help you be effective in that. What you find at this point in time as well, if you're sitting in a retail situation, you're working with particular carriers. Some of those carriers may have perceived that symbiotic relationship that you have with them. You're giving them information. You're driving business to them. You're working the health risks assessment to make their lives easier, as well as creating an extra stipend for you and your agency. But it is an opportunity then to work with a carrier for leads. And during AEP, that is the most likely time that you have a chance for success in that area. We do also offer internet and direct mail support. And what you'll see with the direct mail is a production-based discount, deep discount, that allows you to do direct mail on a consistent basis. Because it's like an exercise program. You do it once, you feel a little bit of, ooh, there's a nice one, but ooh, it's painful. If you do it consistently, you get the full value out of it. And we find that many agents who work in a retail setting will use their mailers to support that initiative as well. It's a great way not only to drive additional business to that third-party location, but it's also a great way of deepening your relationship with the management of that store by supplying them with a copy of the letter you're sending out to drive business to their location. Using this program can deeply discount the cost of those campaigns, and we use vetted preferred lead vendors to do so. We do that in order to make certain that we are vetting the letters that are going out, that they stay compliant, and we protect you in that fashion. We also have different programs out there that help you with direct mail returns without initiating the full campaign. And these are basically purchasing the responses from direct mail pieces that can help you. And we've got a couple of different choices for you in that regard that can help. Those Facebook leads, the internet leads that we use, it's a Facebook program where one is set up for final expense, another one for Medicare leads, Medicare Supplement pieces. So the information on that is available for you as well. So all this said and done, what we're looking to do is create not just a singular marketing opportunity. Obviously, there are different stores that agents have worked for a number of years that are invaluable to their AEP efforts. There are other folks that are just getting into it to create those relationships, knowing a bit about how to maximize that value, working within the store, having the proper supplies at your table or kiosk, but then also reaching into the community to make others aware of the service that you're delivering at that location can not only drive that effort, but also create other opportunities in the community, be they live or an old commercial, be they live or be they Memorex. I don't think they even make tape like that anymore. But all this said and done, what we're looking to do is help you grow your business, earn your business, and make certain that you realize that there are different tools available to you to maximize whatever effort you're making in publicizing yourself in AEP and year-round. It's a question then of committing some of this information to your marketing program, integrating it in to what you're currently planning on doing. And if you hadn't planned on some of this, how can you get it in play quickly? We've given you some information on how to access the different centers of influence in the community. Take a moment, plot out your calendar, set aside information or time to disseminate this information into the community. So that means you're prepared to do what you need to do, and you're looking to outreach to make certain that the traffic, be it live or Memorex, so to speak, is going to be there for you to help. All that said and done, you can reach any of us here at Premier at the toll-free number of 1-800-365-8208 or through our website at premiersmi.com. Bear with me just a moment. I'm going to check to see if we have questions that we missed. Appreciate the compliment. And I think we have probably talked over some of this more than we need to. So what we'll do at this point in time is make certain that you watch for the follow-up that will come from today's presentation. Engage in discussions with your Premier marketer. If you don't have one, let's get one for you. And let's get some of these other programs set up to make certain that retail in the remainder of 2020-421 gives you the opportunity to drive more business than you've seen through retail at any other time in your participation. We look forward to those discussions with you. We welcome the opportunity to discuss the possibilities of different types of marketing initiatives in addition to retail and how you can use them to support each other. And until we have that conversation and speak again, well, hey, we wish you good selling. Thanks so much, and we'll talk to you very, very soon.